everyone. Welcome to the Happy Flosser podcast. My name is Billy Luntz. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It's so great to be with you today. I hope that this podcast helps you feel confident, prepared, and ready to shine and take on the world, whether you're in school or beyond. So today we're going to break down something that you'll use every single day in practice. In-office fluorides. Now, I know a couple of weeks ago, I started talking about fluorides and I kind of pivoted and said, I'm going to talk about caries risk assessment first. So I think that was episode 240. It was just a couple of episodes ago. So if you haven't listened to that one, you should definitely listen to caries risk assessment because that kind of goes hand in hand with how you will educate your patient when you are using in-office fluorides with them or making the determination of using an in-office fluoride. So in this episode, we're going to cover the types of fluoride and when to choose each one, what some of the limitations or contraindications are, and just maybe like a quick memory trick to lock them into your brain. All right, let's get into it. And I'm going to start with the one that we utilize the most, and that is varnish, sodium fluoride varnish, the 5%. So first up, because that's the one that's kind of our go-to varnish. It's the gold standard for most patients. So why do we use it? It is so easy to apply, right? We're not waiting 4 minutes. It's just we dry the teeth off a bit. We use a little paintbrush, right? We've been painting since kindergarten ourselves, so it's pretty easy for us to apply it. It's also safe for anyone, including little people, really young kids. It sticks to the tooth surface really well, so it continues to release fluoride long after the patient leaves the chair. It's really great for our high cavity risk patients, and it works really well for dental hypersensitivity. So that's our kind of our go-to is fluoride varnish. So what are the contraindications to use? So a true allergy, somebody would have to have a true allergy. So that would be something that would keep us from using it, and avoid if the patient is extremely sensitive to resin-based products. And we would know that based on their medical history. So we use the varnish basically on a patient who can't tolerate a tray or gel, anyone who has exposed root surfaces, anyone with a high caries risk, even a moderate caries risk is fine to use, and definitely our kiddos and our adults. So the fluoride varnish is pretty widespread that we can use this on all of our patients, and it's safe on all types of restorations as well, which is really great. So what I want you to think of for V, versatile. Varnish is versatile. Varnish is versatile. It works for almost everyone. So the only ones you really have to be careful of, and you'll know that patient. It's the patient who gets in your chair and they have like 9 allergies listed on their medical history. They're allergic to pine nuts and latex and kiwi and bananas, and they just have all these odd allergies. Those are the ones you want to be a little hesitant on grabbing that fluoride varnish for. And then the next one we'll talk about is the 1.23% acidulated phosphate fluoride, APF gel or foam. Okay, this is the classic tray fluoride, and it could be what we all learned in school, right? It might be what we all remember as kids receiving for fluoride. And why do we use it? We use it because it's extremely effective for caries prevention, and it works really well for patients who tolerate the trays. I can still remember myself as a young kid getting a stomach ache having the APF gel. It's not really great. It's not really great, especially if you swallow it. So it's not good for your stomach at all, as we know. So what are some of the contraindications of the 1.23% APF gel or foam? You do not want to use it on porcelain, on a patient who has a composite restoration or any composite restorations, someone who's already had sealants or glass ionomers, because the APF is very acidic and it can etch these restorations. It's also not ideal for a patient with a gag reflex or someone who has a hard time tolerating the trays, which are little people. Think about how long that has to be in their mouth. It has to be in the mouth for 4 minutes. Okay, so 4 minutes for like an adult 25-year-old is literally feels like 10 minutes for a 5-year-old. I don't know why that is. It's just like how long we've been on the planet and how our time concept is. So 4 minutes is a really long time for our little people to withstand having that tray in their mouth and having to hold still, have their chin down towards the floor so that the fluoride doesn't go down their throat. So that is really hard. It makes that that falls under the list of contraindications for those patients. So the reason why I always talk about kids with APF gel is because look at the other pieces, the contraindications for use on porcelain, composite sealants, or glass ionomers. There's not a lot of adults running around that have a virgin dentition. So the minute somebody has any restorative work, you've ruled out the use of this fluoride. So it's really confined to mostly just of our kiddos because of the contraindications for use. So patient with a natural dentition or older children who can handle the trays and they don't have any restorations. So here's your memory trick for APF. A is for acid. So if they have aesthetic restorations, avoid the acid. A is for acid. So it's very limiting. And I know my friend Dana, she has a great memory trick for this one too. I can't help but think of it. And that's because it's a good memory trick, right? She does the ABCs and 1, 2, 3. So kids use APF because 1, 2, 3, and that's the percentage, right? 1.23%. That will go a long way at helping you remember that the percentage is 1.23, and ABCs, we use the APF gel or foam on our kiddos, and they sing their ABCs when they're kids. So I think that's such a great way to remember that fluoride. And then we have our 2% neutral sodium fluoride gel. And this is your go-to when APF is not appropriate and you can't use the varnish, right? So the varnish is the versatile. You can use it on just about everyone. But if you can't, and I actually will say that the neutral sodium fluoride gel, it's not as user-friendly as the varnish as well, but it gives you a nice alternative um, to the APF gel. So the neutral sodium fluoride, it's safe for porcelain, it's safe for composites and glass ionomers. So it's also really great for patients who have xerostomia or erosion because it's non-acidic. So it's very gentle. I want you to think of like this is like putting your washing machine on the gentle cycle or using like a really gentle laundry detergent with your really delicate clothes. So if you have a patient who could utilize the benefit of a fluoride, but for some reason they can't have the varnish and the APF is too acidic or could etch their restorative, this is your go-to for that, the 2% neutral sodium gel. So who would you use this on? It's not ideal for young children or patients who can't tolerate the trays, right? Somebody with a strong gag reflex, somebody with like a small mouth with tori, it would be hard for them to have this tray. And this also has to stay in their mouth for 4 minutes. That's the other thing that makes it really hard and limiting for some of our patients. But it's great. It's a great alternative for patients who have lots of restorative work, a patient who has a lot of sensitivity, or a patient who experiences the dry mouth. So a memory trick for this one would be N, right? Neutral sodium fluoride, NaF, N for no etching. So if you have restoratives, we're going to choose the one that's neutral. So N for neutral, N for no etching. So that's your other fluoride. And then I have to just put silver diamine fluoride in here, even though it's kind of in its own little category. I didn't want to overlook it and not talk about silver diamine fluoride. So this is such a powerful fluoride for arresting caries. So Well, it's off-label actually for caries arresting because it's marketed as a desensitizer, but we know and why we use it is because it stops active decay. And it's really great for patients in alternative settings who can't tolerate traditional restorative care, or patients who can't gain access to the dental office. We can meet them where they are. We can put silver diamine fluoride on them anywhere, sitting in a hospital bed, sitting in a lawn chair somewhere, sitting in a school chair. So silver diamine fluoride really allows us as providers to really open up the accessibility for arresting decay for some of our patients, which is awesome. So it's really great for these patients who maybe can't get access to care. It's great for root caries and high-risk populations. Think about our elderly patients who have root surface exposure, taking medications that cause dry mouth, and they get these rampant root areas of decay, and they're not able to access the dental office. This is where our silver diamine fluoride really shines. And it's really beneficial on root surface areas. So let's talk about the contraindications. And, this is such a bummer that this is a contraindication. It turns black. It turns decay black. It doesn't turn teeth black. It only turns decay black. So anywhere there's an aesthetic area, you want to make sure that you confine the use of silver diamine fluoride to the root areas. If the patient is aware, you want to make sure that you have their consent if it's in an anterior region, but you want to confine it mostly to the posterior areas. I had silver diamine fluoride applied on my lower left second molar, and it did not turn the tooth black. So what does that mean? It means I did not have an area of decay down there. Actually, the hygienist, maybe she was being really kind because she said, oh, there's a little pinpoint black spot here. Well, that would make sense because we were watching that area. So we put the silver diamine fluoride on there. So it only stains caries black. It does not stain your tooth black. Okay, so that's something that you want to share with your patient and explain to your patient before usage. You want to have their consent. So who would we use this on? Our pediatric patients. Number one, with early childhood caries, this is going to reduce their exposure to negative dental office experiences. It's going to reduce the need for injections or hospitalizations for reconstructive surgery. We can arrest that decay with very minimally invasive care, which is just phenomenal for our little people. And then older adults with root caries, as I had said, there might be some patients that are bedbound or hospital bound or nursing home bound. This is designed for them. Or a patient who needs a non-invasive option, for a myriad of reasons. There's like a whole host of things that I could mention as to why somebody would need silver diamine fluoride. It's also a great way to just kind of bridge a gap. If you don't have the time or there's a space, that there's going to be a space between when that decay was found and when you're able to access the care. So the silver diamine fluoride could be put on there just as a stopgap between where you are right now and then our patient getting the care that they need at some point. At least you are arresting the decay. And the other contraindication I have to bring up is if you have a patient who is allergic to silver, you cannot use silver diamine fluoride on them if they are allergic to silver because there's silver in there. So you want to make sure that you find out if your patient may have a potential allergy to silver. Okay. So a memory trick for SDF: stains dark forever. SDF stains the tooth dark forever. Not literally forever, but it helps you remember the staining, right? It's not forever. So here's a quick recap, guys. Varnish is versatile. APF is acid, avoid with restorations. Neutral, no etching. And SDF stains dark. Choosing the right fluoride is not about matching the product to the patient's needs. It's about making sure that not only it meets their needs, it reaches their risk level, their comfort level, and that you're not using the wrong one for that particular patient. Okay. Hopefully, this helps you kind of put all of those in the right category for you. Thanks, you guys, for listening to the Happy Flosser podcast. Keep learning, keep growing. And if you need any support at all, you know that I'm always here to support your efforts to become a registered dental hygienist. I'll see you next week.